THC is delta-9 tetrahydrocannabinol, which is the principal active constituent of cannabis. Without THC, there wouldn't be any psychoactive effects of cannabis. And the effects are dose-related, as in the more THC in the product, the greater the effects, both good and bad. The content of THC in cannabis from the 1960s was about 4%. And then in 2016, it got up to about 16%. And now it's 35% THC content. Beyond cannabis itself, there are a staggering array of products, including concentrates, that have a THC content of 95%. So when people think about cannabis and studies done on cannabis from the 60s and 70s, where cannabis was 20 times weaker than some of the products that are currently available, they may not understand the risks of the currently available products. The mission of the Yale Center for the Science of Cannabis and Cannabinoids is to provide support for the highest quality research so that we can disseminate that to the public, to clinicians, to parents, to health policy experts. The other is to support the development of a new breed of young investigators who'd spend the next 20 years of their careers studying the science of cannabis to move the field forward. The methods and the approaches that are being used are very diverse. They go from molecular neuroscience all the way to asking someone with schizophrenia, why do you use cannabis and what effect is cannabis having, and everything in between. We find that heavy cannabis users have about a 15% reduction in the number of synapses in the hippocampus, which is that part of the brain that's really critical for learning and memory. And now we are looking at whether abstinence from cannabis in those people who are heavy cannabis users results in some recovery of the number of synapses. We are also supporting a study that will use a technique called ecological momentary assessment, where we will have people with schizophrenia who will be asked to report in a diary how they are feeling at that moment and whether they've recently used cannabis. And that would allow us, in a naturalistic setting, understand the effects of cannabis on the everyday lives of someone with a serious mental illness. So these are really important approaches that are useful on their own, but when they're combined, they are synergistic. And one of the great things about Yale is that we have such a breadth and depth of research expertise, technologies, and methodologies that is really remarkable. The goal is to provide the highest quality evidence in either direction. If there's good evidence that cannabis, for example, is beneficial for certain medical conditions, and that's definitive, irrefutable evidence, great. If there's evidence that exposure to cannabis is associated with detrimental effects down the line, that would be important for people to know. At the end of the day, our purpose is in generating the highest quality information. And then what people would do with that information is really up to them.